clinician from London, but I also work part-time for Briaz Medical. It's given me a great pleasure to be able to organise this symposium. So I want to welcome you to Breathing Beyond Boundaries, Ventilatory Support in Action. I can promise you that this will be one of the highlights of the Congress. So no pressure on Jeanette and Miguel. We've got two amazing speakers who will show us that ventilatory support really does hold no boundaries and practice can be truly inspiring. So we're going to have a really upbeat session. So you've heard enough from me. I'd like to introduce our first speaker, who's Jeanette Brown. She's come all the way from Utah in the States to be with us. Jeanette is an associate professor at the University of Utah School of Medicine and is a pulmonology and critical care physician in Utah. She also works within the Craig Nielsen Rehabilitation Hospital, which I've had the pleasure of visiting, and it is amazing. So if you want to go somewhere to see adaptive technology at a highlight, speak to Jeanette afterwards, and she's probably not going to thank me about all the visitors. So Jeanette's specialist interest area is neuromuscular disease and spinal cord injury, but she does have a wide clinical practice and has been working with long COVID patients. So, Jeanette, I'm going to hand over to you to speak about ventilators in the wild.
Oh, thank you. We're back. Hi. Thank you for having me attend and present. I'm really excited to present this to you because it was something in my career that I honestly was not prepared for. It was sort of a serendipitous collaboration between myself and our physical medicine and rehab colleagues at the University of Utah. And of course, you know, many of our patients were very active if they had injuries, or people just in Utah, I feel like, and in the West are very active people. And so there was this push to combine adaptive recreation with patients that had high level needs. Well, I hope all the tech works. So this is Dr. Jeff Rosenbluth. He's in the red in the behind there. And this is the Tetra ski. So we are able to take patients out, and this is not a passive experience. The patient is not going for a ride. They are able to control the ski themselves. You can see this patient specifically has a hand joystick that they're able to control just like they do their wheelchairs. And if any of you have ever skied, so the patient can adjust whether the skis are parallel, which I think of as French fries, and like this, like pizza. So they can go fast, they can go slow, they can go right, they can go left. But this is really them adapting their ride to what they want to do. And then you can see Dr. Rosenbluth in the back portion has a kill switch and a remote for safety, so you can actually stop the ski remotely in case something were to happen. And then there's also a physical tether there. But for otherwise, the patient's in control. So that's a big appeal for our patients. And here you can see is another way to actually power or control the ski. And this is a mouthpiece adapter. And so many of you are familiar with sip and puff, right? Sip, puff. Well, we have actually changed this to allow the patient to, if they sip, it turns right. If they puff, it turns left. You can do fast, slow modifications. And so this allows them, again, to control the ski without having to use any hand motions at all. But Dr. Rosenbluth came to me and he's like, well, we have our high-level ventilated patients, and we've never taken any of them skiing or done any of our other adaptive recreation. He's like, what do you think about taking a ventilated patient skiing? And I stopped for a minute, and I was like, this is either going to be the coolest thing I've ever done or the dumbest thing I've ever done in my career. Because I'm like, we just fixed these people. Let's not break them. So you'll notice throughout the rest of the talk, I'm going to emphasize safety and redundancy and safety because, of course, I want people to have fun, but I also want them to do it safely. So this is my patient here who's in the chair. I've been given permission to share her story, but she's a high-level quadriplegic patient who had a spinal cord infarct at the age of 26. Prior to this, she was super active. She was a big skier, snowboarder, and she wanted to get out and have a good time. So I'll go through kind of the process that we go through with getting her on the mountain. And as you can see here, this is her in the ski chair. What's really cool about this chair is it's actually on hydraulics, so it can actually sit on the ski lift as well. So we don't even have to have any adaptive equipment to get on the ski lift. We can get on just like everybody else. And you can see she has our extra equipment there on the side, which is her ventilator. And I'll talk about some of the things, but you can see, you can't really see the cords, but we actually wrap all of her tubing because you don't want things to ice up, or you also don't want the ventilator to have temperature issues. So hopefully this works. Let's all pray that the video works. Yay. So this is her in action. So this is her controlling the ski. She's going right, she's going left, she's going pizza, French fries, fast, slow. And what we found is actually, as we started doing this with more and more patients, many of these patients are very secretly competitive or not so secretly competitive. I'll get into that in a minute. But it's been a lot of fun to watch people out here. Oh, sorry. Let's see if I can. Yeah, here we go. But the big deal is, obviously, these aren't normal people just up in the mountain. You have to think about their respiratory concerns. Obviously, if you have a quadriplegic patient, you have inspiratory and expiratory muscle weakness. You have autonomic dysreflexia. So remember, these folks can't thermoregulate. And so when it's cold outside, they're cold. And when it's hot, they're hot. And so we have to think about that they can't propriocept and tell you they're cold. So we have a lot of heated vests, heated blankets that we use for them. And notice that we're outside on what's referred to as a bluebird day. We can't take them out into really inclement weather because we obviously needs to be safe there. And then you have to think about their lung compliance and their apnea and hypoventilation. When I'm going to take a patient out, we have a safety huddle and we talk about how vent dependent they are. How long can they be off their ventilator? Have they had any ventilation issues or trach issues? Just so that we're aware of these things beforehand. And as I affectionately say, snot and spit freeze. So you have to also think about the temperatures that you're exposing them to. The ventilators also themselves, many of them are only in Fahrenheit, into the, maybe into the low or high 30s, maybe low 40s. But we are actually going out in colder temperatures than that. So we actually will put a heated blanket around the ventilator and make sure all the ports are where we can access them if we're getting up to the mountain, and make sure that we also have additional battery life. Remember, when you go up skiing, your cell phone, dies faster. We have to do this for a lot of our ventilators. We have at least 3 battery backups plus a full ventilator setup as a backup. And then we also, if I have a trach patient on the mountain, we will use we have a full trach setup as well, just in case. We have an emergency to go bag, which includes an ambu bag, just in case you have to bag them, and I'll show that in a minute. And then again, training sessions and redundancy, and then we have our respiratory therapists that come with us as well. So first thing is, it can be a little challenging to evaluate somebody's needs because every patient is a little bit different. So we actually have our garage where we take patients, and this is one of our other patients that participates as well. And we've got her in the ski chair, and we're making sure that she fits, because a lot of these folks don't have any core control, right? And so you're going to want to make sure that they're able to not tip over when they're on bumps and things like that. And then we're going to look at their ventilator. We're going to have their settings known. We're going to have backup settings or high vent settings, depending on what we need. And you have to evaluate them at altitude. We're in Salt Lake City, which is like 4,200 feet. I forget how many meters that is. But we want to see that they're not hypoxic at altitude, because then we're going to go up closer to 9,000 to 10,000 feet sometimes, depending on which ski resort you're at, and you want to know that ahead of time. And then we have that safety huddle about that emergency equipment I just talked about. And then I'll show you really quickly, we also evaluate the weather that's coming up. But then this is the simulator experience. And this is my patient. And this is her, getting fitted for the ski and learning how to use the controls. She has a little bit of left-hand control. And so you can see she's able to adjust the different positions of the ski there. So fast, slow, right, left. And then the other fun part is to actually be able to incorporate virtual reality and other adaptive technologies. So this is one of our other patients actually learning to use the ski controls, but you can see that he has in front of him on the TV an actual setup of what the course would do and what his ski control, like if he turned right, what it would do. And it's really funny how competitive some of these kids get with trying to get the high score and beat their friends before we even get to the mountain. And then the other cool part about our adaptive technology is we can actually even take kids as small as 40 pounds. This has been our youngest patient that we've taken out. The cool part about this is because we're supported by a charity foundation is this actually doesn't cost any of our patients anything, and their families can participate as well with no cost. So you can see there, one of the things that's interesting, he actually has one of the hand joysticks that looks like a U, but we can actually 3D print a joystick custom to that patient. So if they have more movement in one dimension or another, they can do that, which is really fun. And so because we have other seasons, we have other sports. This is actually me sitting in the sailboat. This is actually something easier for a lot of patients that may be a little intimidated by participating in adaptive recreation. This is actually easier for them to do because it's a little less jolty. But we go up to a canyon just north of Salt Lake City, and it provides people an opportunity to get out with their friends and family. And then again, we do a lot of safety debriefing and scenarios specific to that patient, depending on how much vent dependence they have, and also reviewing ahead of time, their mouthpiece controls and things like that if they need help adjusting those in the garage. This is really fun. This is our patient again, and these are actually her kids, and I'll show you a picture in a second, but this is Dr. Rosenbluth, and then this is also one of our respiratory therapists on the boat, and she's able, with her mouthpiece control or joystick control, to unfurl that sail, to turn right, turn left, fast, slow, so it's a lot of fun. And then she gets to be the center of attention with her kids, which is really cool, because a lot of the times when we do it, they're doing activities, they don't get to participate, they have to watch. Well, she's in the middle of it. And then that's us on the jet ski in the background, lurking for safety. We have a full setup on that, including ambu bag and also additional safety equipment just in case. These are actually her kids, which is really cool. And people ask me, what made you get in this? Because there is, additional risk, obviously, because we're outside in the elements, things could go wrong with a ventilator. But I'll tell you, it's the best day at the office, on the mountain or out the lake. Being able to see patients I've known since their injuries, really enjoy getting out, being back with their families, and, having the wind in their hair. And, in my mind, this gives me a lot of the why that, on the hard days in the ICU when you're frustrated, this definitely helps. This is actually one of my patients as well, with his whole entire family out there. And it was interesting to walk with him through his journey of learning how to use his ventilator all the way through going home and now out on the sailboat. But again, safety is key. This is Dr. Rosenbluth after we tried to drown him intentionally. Part of that was actually to see how long it took to inflate the inflatable life vests, and then how would we actually bag a patient if we were in an emergency. So we used him as the test dummy. He survived mostly. And then, of course, if you give our engineers long enough time and a challenge, it will be like, what else can we adapt? So here's the mountain bike version. This is currently set up for people who have hand control, but they're working on a version of this with the sip and puff that our high-level injury patients can use. And then, of course, getting back to the competitive nature and the community factor, we have a ski race every year, and it's actually named after one of our prior patients who unfortunately passed. But he and Dr. Rosenbluth were the big ones that actually did a ton of the testing for the Tetra ski to be able to really bring people together in community. And we basically use this as an opportunity to have a big outdoor party and happen to have a ski race associated with it. But again, my patients are super competitive. And of course, we're having another one this year. And the QR code will take you to the information about that if you just happen to be in Utah in the US. But it's really awesome. And actually the picture of this is actually our social worker, who is also a Tetra ski racer herself. And so it's pretty awesome. So we're spreading the love. The Tetra ski is now in these particular states here, and then also in Canada and France, where we are currently, the Netherlands, Switzerland, and we just added Sweden, Argentina, and Japan to the list in the next year. So the reason why this is important actually is because Utah was the host of the 2002 Olympics, and we've been awarded the 2034 Olympics. The goal is to actually get the ski as part of an official sanctioned event at the Paralympics. And I think what's cool about that is we are expanding the concept of adaptive athlete to include patients with very high level complex disabilities, but are still people who want to race and are still athletes at heart. So it's pretty awesome. But for those who have any questions or thoughts, I'm happy to take those now or later, depending on when Michelle wants to do this. And if you have any additional questions, this is our website, and that's my email.
So are there any questions for Jeanette? We're going to take a few minutes to explore some of the burning questions you may have. But while we warm up and go to the microphone, Jeanette, you showed us some of your patients that have got invasive ventilation. I know you also do things with those with non-invasive ventilation, and I just wondered if you could talk us through a little bit about the differences, but also we know that looking after people non-invasively, you may think that they need a lower level of care, but actually because of mask displacement, secretions and other things, it could be that they need a higher level of care. So I just wondered what your balance was.
Yeah, it's an excellent question. One of my patients is a high-level spinal cord, but was able to wean off ventilation during the daytime. But at altitude, with additional kind of stresses on her respiratory system, we actually will use the non-invasive with a nasal pillows on the ski for her for some extra support. We also, when we're skiing there, our respiratory therapist has actually supplemental oxygen. We use the carbon fiber oxygen tanks, which the mountain climbers use, which I learned about because we were like a regular, cylinder is very heavy, and if you've ever skied, you probably don't want a 20-pound thing on your back. So we've actually adapted some of the other tech for other sports to help this. But yes, you do have to evaluate them, I think, at like our standard altitude, but then also have backup equipment just in case they get into trouble, because this is something that they may have, a stressor they may have not experienced. Other thing is that I'll do kind of a safety evaluation, any recent illnesses. We have our cough assists available depending on, mask versus trach. But again, because you're just jolting people around, you can see different things you wouldn't normally see in the clinical environment.
What happens to frozen sputum? There's a fair few physios I can see in the audience, and I've never experienced frozen sputum. I've experienced too sticky sputum, but
so
frozen?
You worry about bronchospasm, but you also worry about just viscosity. So what we do is we actually wrap all the tubing in fabric to help to insulate that, and then we actually have around even those tubings for the mouth, because snot and spit freeze, to make sure that that doesn't gum up while you're trying to use the setup. So a lot of it is just kind of being mindful, and then we don't have patients out for too terribly long. There is kind of a limit. We'll do like a 2 to 3 hour session, but it's not like a standard person that could go out for all day.
I seem to have all the questions here. Would you like to come to the microphone?
I actually have a patient in mind. I was wondering, how do they get a hold of you, and do they have to live nearby, or can they just travel in for a vacation to see you guys?
Yeah, we do take folks that are from out of state, and then you'll notice that there are other skis available, like into the different states. Let me go back. In these states, if you're in the United States, but if you contact us through that QR code or just send me an email, we definitely have had visitors that we allow to come participate. What we ask is they're at least there for a couple of days, especially if they come from sea level, to adjust to altitude, and then we will evaluate them in the garage, evaluate their special needs, get them fitted, and then take them up.
Okay, I missed that QR code. I don't know if we could go back.
It's this one. Yep.
Oh, it's not on the board. Is it possible that we could just put the QR code back up, technical? Thank you.
Yes. And if you just Google University of Utah trails, that's what will pop up.
And mouthpiece ventilation. So we've got lots of people that are on it. If you've then got a sip and puff system that's controlling it, is that something that they just can't do?
Yeah, usually what I'll do for that is I'll go to the nasal mask for their respiratory support, so that leaves their mouths free. But it's really nice because we have the simulator where they can practice it, but then they can also do it on the mountain as well, or out on the sailboat. But it is a little bit of a practice because I've done it myself, and it does take some coordination. But I find my patients who do use sip and puff on a regular basis are really good at it.
And finally, do you change people from the ventilator that they're on, or have you managed to adapt all of your technology so that it can just encase whatever they're on and they use their home vent?
I try to stick with their home vent to start with, if possible. It just depends on if I have a backup setup for their home vent, which I usually do. But I try to, because I know that it's like tuned to them and they like their comfort settings. We can often start with just what they use because we have the ability to take different vents up.
Any other questions from the floor? Yeah.
Yes, thank you very much for this great talk. I'm Jessica Tetar, I'm from France. I have a question. You say that they are moving a little bit. It's jolty, as you said. Do you feel that there is a positive effect on secretion management, maybe an airway clearance when they do the skiing?
Yeah, so far I've not had any problem, because that's one thing I worried about is like how many times have you rolled a patient and it jostles up secretions. But in general, I haven't found it any different than being just say up in their wheelchair, which is kind of a similar structure. The thing you have to make sure of with the jostling factor is that they're secure in the seat and they're not just flopping around. So head control is helpful.
Thank you.
So, Jeanette, thank you so much for an excellent talk. I'm sure you're going to be getting loads of people coming over.